I'm here with Dr. Robert Muller, an expert trauma therapist and trainer. And we are looking forward to his upcoming two-day training in relationship strategies to treat challenging trauma clients. Dr. Muller, thank you for joining us. What can participants expect to learn from your upcoming training?
Well, thank you, Rosie. I'm really looking forward to doing this two-day training. You know, when I started working on my book, Trauma and Struggle to Open Up, and then the workshop that I'm going to be presenting, there was a lot of work on safety when working with trauma clients, using grounding strategies and other sort of strategies. But what I noticed was there wasn't a lot out there on specific relationship-oriented strategies in the work. And while people value the therapy relationship as a general concept, what does that mean more specifically when we get to specific strategies? And so I'm going to be looking at countertransference, that is the therapist's feelings in the treatment. You know, with challenging clients, our own feelings become very important and can influence the therapy in positive or negative ways. And how we pay attention to our feelings and use those feelings can make a huge difference in outcome. I'm also going to be looking at therapeutic enactments, and that is to say, when we fall into some kind of acting out without realizing it in subtle ways. Even if we're excellent therapists or starting out therapists, we may find ourselves doing things or saying things with clients that raise feelings in us, and this turns out to be problematic in the work. And so how do you navigate those, what are called enactments in the therapy? And then also, if things go off the rails, and it's very possible for things to go off the rails, especially with clients who are diagnosed with trauma histories, how do you get things back on the rails? How do you navigate through that so that you work with a client where there's maybe some sort of micro conflict or difficulty in the relationship, and then you need to get things back on track? How do you do that? How do you do that when the client has a lot of feelings toward you that are problematic from their perspective? They're upset with you, or the therapy is actually threatened and they threaten to leave, and it's premature. It's way before they're really ready to leave. And so how do you help them through that? In other words, how do you navigate relationship ruptures so that you can help the client heal, and so that ultimately this therapy can lead to what's called a corrective emotional experience, so that they, through the course of therapy, can find themselves learning and growing and developing. And so that's what we're going to be doing in this workshop. This workshop is for people who work with trauma clients, but it's also more general than that. It's also for people who work with a variety of different clients, because the therapeutic relationship is so central and it can be very subtle. And so that's what we're going to be doing.
That is amazing. I'm really looking forward to learning from you, Dr. Muller.